Today is Giving Tuesday, and if you've been an active part of nonprofits and charities, you know that today is an important day to fundraise and gather support for your cause. Whether it be fighting poverty or advocating for clean water or anything in between. My first exposure to Giving Tuesday was during the COVID-19 pandemic. I launched this podcast for the first time and was getting more and more curious about global health, philanthropy, altruism, and social impact. Each year, I witnessed organizations campaigning and fundraising around this day, but I never dove into the origins of Giving Tuesday and how it's become so significant to nonprofit organizations around the world. So that's what this episode is about. I thought I'd save you the time and do the research for you. All about the origins of Giving Tuesday, who founded it, why it's important, and to end the episode, I will be sharing 3 amazing organizations to consider contributing to today or in the future. So make sure to listen until the very end. My name is Hathel Baman, and this is the Global Health Pursuit. Giving Tuesday was founded in collaboration with the United Nations Foundation in 2012 by Henry Timms, who was the executive director of the 92nd Street Y in New York City. It was created as a response to the overwhelming amount of consumerism and capitalism that occurred each year on Black Friday and Cyber Monday. The main goal was to shift interests that are directed towards selfish desires to direct them more towards selfless actions, such as charitable giving and altruism. The movement was started by marketing the hashtag Giving Tuesday. From then on, Giving Tuesday went viral almost immediately and evolved into a global phenomenon. The very first donations that came in amounted to $10 million and spiked to $28 million just the next year. Ever since then, there's been continued momentum. And even despite the circumstances of the pandemic and economic constraints that we've seen over the years, in 2022, a record-breaking $3.1 billion had been contributed with over 35 million people participating. But the question is, why is this movement so significant for nonprofit entities? The answer to this is threefold. First, it represents a huge surge in generosity. Giving Tuesday is a way for individuals from diverse backgrounds to come together to support causes that are close to their hearts. People often give to charities that they have firsthand experience with, may it be cancer, human trafficking, or mental health. I was drawn to organizations working on global health and poverty alleviation after witnessing poverty in India and then fully understanding what my own family had to go through to create better lives for their families, including me, my brother, and my cousins. And because of this, nonprofits see a surge of not only donations, but volunteer interests as well. It's also an amazing opportunity for nonprofits to grow their followership and audience and reminds people to think of social causes. Number 2 is that Giving Tuesday is a day that showcases nonprofits and their missions amidst the usual digital noise of pop culture, of news, and current events. The day gives a dedicated platform for nonprofits to utilize media coverage and social media to attract potential supporters on a global scale. And finally, Giving Tuesday plays a significant role in cultivating a culture that promotes philanthropy and encourages individuals and corporations to prioritize charitable endeavors. Today, almost every business has a corporate social responsibility group, and rightfully so. Giving Tuesday creates a notion that every single contribution, no matter how small, holds significance, which ultimately fosters a more compassionate society. And that's something that we definitely need more of today. So after you've spent quality time with your family and stocked up on gifts for your loved ones, and of course yourself, we ask you to give some love to your favorite causes. And I want you to consider adding one or more of these 3 global health organizations to your list. The first one is an organization called Mile Pediatrics. This organization is for pediatric healthcare professionals and advocates who are passionate about serving children in vulnerable areas around the world. I'm naming them because I was able to witness their work firsthand at their pediatric clinics in El Salvador. Mile Pediatrics was founded by Dr. Jeff Mapp and his wife Kimball Mapp to provide repeated pediatric care to communities that face significant barriers to receiving treatment. Since their founding in 2018, they have been able to see and serve around 300 children each visit. Mile is especially dedicated to witnessing a child grow and become more conscious of their health over the years. So if you're intrigued, make sure to check out episodes 30 and 31 to learn more about why Mile Pediatrics is so impactful and to hear stories from team members on the ground. The second organization is the Global Organization for Health Education, or GOHE for short. GOHE is an organization that was started out of the mere desire to educate those around the world about neuroscience and neurological conditions like epilepsy. The founder, Tigo Daniel Joyam, grew up in Cameroon with a brother who lived with epilepsy. And through that, he later developed a passion to educate others that epilepsy is in fact not contagious. Now, if you're listening to this podcast right now, you might be thinking, well, obviously it's not contagious. But imagine growing up in a rural community in a country like Cameroon, where the educational system isn't as robust as yours might be. Many belief systems of members of society are formed through myth and religion. So to think that those living with epilepsy might be possessed by the devil might not sound so far-fetched for individuals in communities as such. After learning all about epilepsy, Tigo decided that it would be his mission to arm and empower underserved and last-mile communities with the knowledge they need about neurological conditions such as epilepsy. And he wanted to do this so that those who do live with epilepsy can then become contributing members of society without the fear of being shunned by their community. If you're somebody who knows someone who is living with epilepsy or is someone who lives with epilepsy, definitely learn more about this organization. They're doing amazing things. Make sure to check out episodes 34 and 35 to learn more about Tigo, his story, and the mission of GOHE. And finally, I can't forget about Sign Fracture Care International. As an engineer who used to work within research and development groups of the joint reconstruction and trauma orthopedic spaces, I used to ask my coworkers and managers what we were actually doing as a company to serve not just those who have deep pockets and access to health insurance. People don't just get into accidents in developed countries. We actually see a need for orthopedic surgery all around the world. In fact, in 2019, 93% of road traffic injury-related deaths occurred in low and middle income countries. And the risk of a road traffic death is 3 times higher in low income countries than in high income countries. When these injuries occur, most of the time, people are not able to afford surgery or end up getting alternative treatment methods to replace surgery. Sign Fracture Care is a remarkable nonprofit medical device company that aims to fill this gap. They design and manufacture their very own trauma medical devices and instruments that fit the needs of low and middle income surgical settings. What's even more impressive is their network of dedicated trauma surgeons around the world. So if you're an engineer, maybe even an engineer working in medical devices, check out Sign Fracture Care and consider giving to them. And if you want to learn more, go back and listen to episodes 14, 15, and 16, where I speak to the founder, Dr. Louis Circle, the CEO, Gene Dillner, and their very own engineering manager, Terry Smith, and I ask all things trauma orthopedics targeted to serve vulnerable populations worldwide. Extra Mile Pediatrics, GOHE, and Sign Fracture Care all have missions to further health equity for communities all around the world, but they're doing so in different ways. So today, on Giving Tuesday, or whenever you're listening to this episode, I would like to ask you what you're most passionate about and find a cause to donate your time or money to. And if you found any value from this episode, would you do me a huge favor and rate and review this podcast on Apple Podcasts or Spotify? It truly helps me get in front of more people just like you. Thank you so much for listening, and I'll see you in the next one.